our regular council meeting of Tuesday, March 25th to order. And we respectfully acknowledge that this meeting is being held on the traditional territory of the Kwagah people. I'd like to add an amendment to the agenda and add an in-camera meeting at the end of this meeting under section B.
Which I'll read out for you, which is personal information about an identifiable individual who is being considered for a municipal award or honor, who has been offered a private gift to the municipality or a condition of anonymity, on condition of anonymity.
So may I have approval of the agenda as presented or as amended? Councillor Tidbury, seconded by Councillor Texmo. All in favor? Thank you. We have the minutes of our regular council meeting held March 11th for adoption. Councillor Tidbury, Councillor Smith. Any errors or omissions? All in favor? Carried. So we have delegations and welcome. So 4 chairs up here, even though you're sitting at 4 chairs back there. And if you'd like to move close, you could, or you could stay there. So our community paramedic, Emergency Health Services Provincial Health Authority Introduction Council. So welcome, Waj.
Thank you. Yes, Waj. Yeah, I just started the new position. That's why I wanted to come in and introduce and like just provide some information what in that position, in that role I can do, and how can I be helpful in community. Today, I mean, I have Srida, our station unit chief from Port Hardy, Nat, North Island district manager, and Amanda, the unit chief at 129 Port McNeil station, and also my program mentor. So yeah, my name is Waj. I am the community paramedic here in Port Hardy. Community paramedicine, at its core, the model of the community paramedicine of care is it kind of extends the role of the paramedics beyond the traditional emergency response. I focus on providing proactive in-home care, which includes managing chronic conditions, conducting health education, and participating in community outreach efforts. I conduct regular home visits for patients, especially those dealing with the chronic conditions like heart diseases, respiratory issues, diabetes. During these visits, I monitor their health, manage medication, and ensure that any change in their conditions are addressed before it becomes an emergency. The goal for this position is simple: to reduce unnecessary hospital visits, improve health outcomes, and provide patients with the support they need to stay healthy and live independently in their home. This is community paramedicine is like a healthcare model which focuses and prioritizes the prevention and early intervention and ongoing support to the patients and enabling them to stay at the comfort of their home. I'm also, other than managing the health condition and working with them, I also an educator. In that role, I help patients better understand their conditions and provide them with the knowledge they need to manage their health. I provide information to people on how to prevent complications, adopt healthier lifestyle, and better manage their care. I work through collaborating with our other healthcare providers. So I do collaborate very closely with other doctors, nurses, or any individuals that are linked to that client's health. It enables me to provide a holistic, comprehensive care for each patient. I assess health conditions, monitor progress, communicate with associated healthcare providers, and adjust the care plan as needed. I also use mobile health applications like home healthcare monitoring, or phones, to track patients' data remotely. This allows for continuous monitoring and ensures that the healthcare team stays up to date on the patient's condition. Community paramedicine is committed to health promotion and outreach. In that role, I organize health education programs covering topics like nutrition, first aid, CPR, naloxone trainings, and diabetes management. By educating people, the aim is to empower them to make better health decisions and take proactive steps to prevent illness. I have also in this role to set up the wellness clinics, which currently I have one running at the senior center. One I'm starting soon in Salvation Army, and the other one in Fort Rupert Health Center. These wellness clinics include checking blood pressure, blood sugars, and other vital signs. And if I identify any health risk, I refer patients to appropriate healthcare providers for further care. This focus on health education and community outreach not only benefits individuals, patients, but strengthens the overall community health. By engaging with residents and building relationships, we help create healthier and more informed communities. And most important, all these services are free of cost. Thank you for your time. I would be happy if you guys have any questions.
Thank you. Counselor Texman.
No questions, just I didn't really know much about this, and when I seen this on the agenda, I was super curious, and you answered everything I was curious about, and I think what a wonderful position and how great it is for our community to have something like that, especially being that they're free services and it's not just one thing. Everything you mentioned is so huge for seniors and people that aren't able to get to, urgent care or anything. It's great, so thank you for your presentation.
Thank you.
Counselor Robinson.
Yeah, thank you for your presentation, and I echo everything Brian said. I'm not sure how long the position's been in place. I'm just wondering if you've seen a reduction in, say, emergency or primary care visits, because you're able to deal with things at home.
We'll let Amanda answer that one.
So this program has, this was part of cohort 24. We started in Port Hardy with cohort 1, actually. We were a pilot project and have had 2 positions available, not always filled. And we have 100% seen a reduction in 911 calls with patients that have chronic health conditions, specifically with CHF, heart failure, as well as our palliative patients. And so palliative patients are a new arm in the last 4 years to the CP program. And where that really is noticeable, and especially with hospital closures, things like that, when someone has chosen to be a palliative patient at home in the comfort with their family and everything else, that care can be challenging sometimes with some of the gaps that we have in our health system. And so we have seen some great reduction, especially across the province, where CPs can go in and help the families find some of those gaps and create some connectivity with the other resources available in the community specific to what that patient needs. And then with CHF, so congestive heart failure, COPD, respiratory, it means that we're catching things earlier. So if somebody is in a COPD flare-up, we have a flare-up plan with the physician already in place, that the medication that they need to stop that from progressing has already been prescribed. So we know how hard it is to reach physicians and get a doctor's appointment in a timely manner when someone's having that acute crisis. So we're able to start that flare-up plan and let the doctor know that that's where we're at so that they can follow up with the patient. And then we can also create a steady follow-up after to make sure that that plan is working. And those are where we see the biggest reductions of hospital stays. We're also seeing, on top of a reduction in the 911 system when a CP is in the community for a long period of time, a reduction in the hospital length of stays that they're having. And so we have been able to see those extensively throughout the other parts of the province. And so given the fact that WAJ is a local, young and very good at this job, we're really excited to see that long-term effect come to Port Hardy. Thanks.
That's great, thank you.
Counselor Jacobs.
Thank you, Waj, for your presentation. That was awesome. Now, what support do you have for yourself? Are you the only one that's doing this in our particular area?
In Port Hardy, yes, and support, like, I'm sorry.
So if you're not available, they fill a gap. Is that how it works? Or no?
filling a gap. In terms of filling a gap, no. So we have like this one position here, and I
Okay.
do work from Monday to Friday, 8 to 4. And I'm not planning on going anywhere, so that's gonna be for a long time. In future, I mean, with the more expanding, probably there might be 2 CPs per communities, but this is something right now, I am the only one here.
Okay.
We have one in Port McNeil.
Lucky on the North Island, we actually have a CP position in every community of the North Island, and so we do vacant positions in Alert Bay and Port Alice and Sabalas. Santula has an amazing CP that's been in practice since cohort 5. And we do have what's called an RACCP in Port McNeil that is currently filled as well with an advanced care paramedic. And so the scope changes a little bit of what they can do. And so WASH could have some support with patients that are a little bit more critical on just adding to the scope of what we can help with. Right now, there's no plan to expand. Monday to Friday is a new expansion. WASH is the very first very first CP in the North Island to work 5 days a week. And so we're really excited to see what having continuous care is. But because it's not the same as an emergency paramedic, we don't have night coverage or weekends, and we don't backfill holidays as of yet, although we're always looking to expand. But as everybody knows, there's always, lots of talks and communications that have to happen from different levels of the organization before any of that is ever going to be thought and promised and everything. We're just working on making a really good provincial community paramedic program in the parameters that we have right now. And when that starts to, show its progression and everything else, then who knows where that could go.
Yeah, so based on successes in the communities and how, like you've already said, some of the benefits with regards to the data, ministry like data, right? So more data that we can give them, the more opportunities there are to help build on that. But when you take into consideration, our particular end of the Mount Washington Regional District for number of people, residents, we're the largest area. If you take into consideration Port Hardy and our Indigenous nations in our particular area, we got a lot of population up here. So to have one person in our community compared to Port McNeil or Port Alice or Alert Bay, I mean, we got a lot more people. So what can we do to help you to get 2 people in Port Hardy?
Right now, WASH is still collecting clients and people. And so because we have the ability to see people both in home as well as through home health monitoring systems and virtual care, as well as groups, then our goal will be to maximize as many people as he can see and see where that fits. If at a time that we are seeing that he has what we call a wait list that is extensive, then that is the data that the community paramedic program uses and the government uses to say, we might need some more support here, or this is the right amount of hours for the right amount of people, and we use that as our data point. But the community paramedic program at the head of it checks that data very regularly. So I would say probably more than just once a month, that data is consistently checked. It's one of the best programs that I've seen in BC Ambulance for continuous change where change was needed. And it's an amazing program that has been able to amend where needed for a community's need. And the nice thing is the fact that WASH can do groups means that we can bring in 20 people to come into a walking club. And so when we're supported through the community by having things like free gym being accessible, means that we could start something like a walking group where a doctor could come to a walk and talk, but it's indoors. And so it doesn't matter if you're in a wheelchair or a walker, or if you totally can walk without any aids, you have the same access to care. And so in the province, we've been able to do things like that. And then we also do a blood pressure clinic at the same place. And we can also answer questions about that new diabetic, diagnosis that's a little bit scary and you don't know how to get in touch with the nutritionist and stuff. And so
by being a bridge to the gap to many resources in one large area, it means that we can see more people than just in their homes. And that really adds to what the program is able to do. And that's why it's one of the pillars to have the community outreach. So Waj getting to share this and his passion is amazing, but where it really starts to work is when the community works with the CP and we have areas and places and the support to give him the buildings to meet into, because stations are not very big and ambulances only fit so many people. It really means that he can help develop that program into something bigger and better for the community as we, get those resources and the teamwork.
If I could speak anecdotally to your point, I was the unit chief up here for 4 years. And in that time, I had 2 community paramedics that worked under me. The number of hours that they filled in a week are identical to the number of hours that Waj now fills, only it's spread across 5 days instead of 4. During that time, the 2 community paramedics that were here had not reached capacity. So I get where you're coming from, wanting 2 people. It's definitely something that Amanda mentioned that is visited often to see if we're meeting the need. And as he gets filled up, it'll be revisited again, but we're not predicting yet that that's going to be a problem over the next 2-3 years.
Okay, so how does that tie in with community health services, Sea Island Health? Like, did they give you the referrals to Lodge, or how does that work?
Separate stream. We don't cut their grass and they don't cut ours.
We work very closely together.
Yeah, that's what I'm saying.
So the doctor, the nurse practitioner does give us, it has to be an MRP, so a responsible physician or practitioner that gives us, it's the only referrals that we can take is from a nurse or a doctor. And that is because we want to be able to communicate right back to them. There's not multiple sources. But with community health, Waj meets them with them weekly. And we team up to do safety checks together. We team up to say, okay, I saw that you were, meeting with so-and-so. So I just wanted to reach out. Did you also see that difference? Or, maybe we need to bring the OT in because they need a shower bar or some help around the house or the bedroom. And these are our concerns. And so it becomes a very tight team when everybody is able to work together. And because we don't do the same job, it means that we have nobody being threatened. So it's not that they're charging and so somebody doesn't want to see them because we are free. It is that we can start building the amount of resources that a person has access to, and we can give people better care without having to leave the community in a way that they may have had to before.
Great program.
I am very passionate about it and I am so excited to see what Waj is able to do with it because I think that we have the best fit for this community. He is going to be amazing in this position.
Perfect.
And
I couldn't agree more. We work well together.
any other questions, comments? Thank you. I want to thank you very much. I know a bit about your background. I'm super thrilled that you're here and in this position. I know that you're committed to our community. And I was here when the first cohort one, I didn't know that's what it was called, started, and we were a pilot project. So glad it's still continuing and it's spread out so much, and hopefully the other communities can get someone just as good as well. Maybe not as good.
Yeah. And they
And I
can.
know the person you have in Port McNeil is outstanding as well. So we're very fortunate on the North Island for the 4 of you, but as well our other community outreach person. So thank you.
Thank you.
Thank you.
Thanks for coming.
You're welcome to stay for our whole council meeting, but we don't make anyone stay.
Why? It's free. You can stay here. It doesn't cost you.
Thank you so much for your time.
You
Thank
guys have a
you.
great night.
Thank you.
Night.
See you later.
That'd be great.
Yeah.
Yes. Perfect. And now we'll.
We'll make sure we bring the pamphlets and the cards.
Oh, that'd be
Thank you.
great.
Yeah, thank you.
Thank you. So business arising from our minutes and unfinished business, we have our council action item report for information. Any comments? Okay, no new business. We have correspondence from Ben Giselbrecht, President, Association of Vancouver Island and Coastal Communities regarding request for participation, the roadmap survey. I don't know if any of you looked at it, I've just printed it off, but I was thinking maybe if we could get together as a group to do the survey.
That'd be the best idea, yeah.
It's been an issue for quite a while. Yeah,
Yeah, and so now they're doing the legislation update or review and maybe I'll see if our CAO can organize a time that we can come in and
what a good idea.
Right, we have from Matt Picarn, President, BC Road Builders and Heavy Construction Association, partnering for a stronger future, Road Builders Strategic Plan and Prep Book. For information. Interesting.
Yeah, very well laid out too,
Yeah.
like all the projects and equipment needed and everything. Yeah, it's a lot of it.
There's a lot of stuff going on.
We have from Core Nelson and Sherry Labor organizes Festival of Lights requests for council letter of support. So this letter, it's just a draft, but they're hoping to apply for grants to improve and make better the Festival of Lights. So they're asking for a letter of support.
I'll
I'd
make
like to
that
make-
motion.
Yeah, we're all on the same
We're
page,
all-
yeah. That was great. Super good. for the
Moved by
community.
Councilor Smith, seconded by Councilor Texmo, third by Councilor Dorwell. Any comments?
Just think it's great.
It's amazing.
Yeah.
All in favor? Carried. We have plant from Lance
So,
Gallagher, thank you. Hardy Bay Lanes, request for bleacher use.
Mhm.
So this bowling championship is the first one that's being offered up here in many, many years. So they're expecting a lot of people.
Mhm.
is it possible, can the bleachers be moved that way? I have.
CEO Nelson Smith.
He works for Guild
Yeah.
already, probably.
I did reach out to our operational services crew, and they're looking at if we, because they've already reached out to Courtney in advance of actually putting in a request. So they figured that they would take the Park Drive bleachers, so close to being in town. And it would take about 2 people with probably about an hour to actually move and secure the bleachers and get them to their location. So that would be the cost that the district would be putting forward is two people for about an hour to 2 hours.
Looking at it like that.
So would that go under the grant and aid?
We would probably charge it to Brandon.
Yeah. Councilor Dorwell?
Yeah, I hope we can help them out. I just want to make sure that there's no ball tournament or something that,
Not
whatever
on
field
Park
they're
Drive, I
thinking.
wouldn't think.
Well, the minor, baseball does
Yeah.
use that. but Just want to make sure that there's nothing, just double check.
I don't think we have any. No.
Yeah, no, great.
Until May. Thank you.
Okay.
Yeah.
thank you.
Yeah, I'm happy to help. I would, motion.
Moved by Councilor Dorwell, seconded by Councilor Smith. Any other comments? All in favor? Carried. So when they're on, you should all go and support them.
It's pretty cool.
I get to go and throw the first ball.
Yeah.
They might put the bumpers up for me. I'm gonna talk
Yeah, no pressure.
Get a strike and they'll be wanting you to go in one of the.
Right, well, yeah, I don't think I'll get a strike.
See-through ball with a rose in it.
And it is a Canadian game,
Yeah.
Well, there you go.
5-pin bowling.
5-pin bowling.
From Brandon Thompson, Executive Secretary, Triport Pride, request for parade, park use and flag raising. So CAO Nelson Smith and I've had a little conversation about this. Because the request is quite extensive. So I'm gonna go backwards. We talked about the flag down at Carrot Park and it could go up for the day that they're doing the, picnic down there and events, but
That weekend, you mean? Yeah, the weekend. That they're having it on,
they're having it on a day, right?
or just one day?
If it's one day,
No, Sunday.
Sunday, June 29th. Oh, sorry. Saturday,
June 29th.
June, okay, yeah, June 29th.
Sunday, you were right.
Okay, thank you.
You could,
And then, but that would be just at Carrot Park when they're having the event down there. And then have the, like we normally do is have the pride flag raised out for the month out here, except for on Indigenous Day and any other day that, it has to come up and down. So then for the parade, did you talk to them,
About the road.
about the road closures?
Yeah, so Louisa actually reached out to them directly and explained that the road closures would be the responsibility of them. We provide all of the barricades and everything, so the insurance would have to be obtained. They'd have to make sure that they have individuals that will have to met person every single one of those barricades all the way along. We do have some concerns with some of our intersections, but being that it's a Sunday, there's a lot less traffic that's going around through town. It's not like it's a regular Saturday or a Friday afternoon, but we would have to put up the barricades on the Friday. Otherwise, we're incurring overtime, both single and double for the weekend if we have to bring anybody in. So there's a bit of a concern over just leaving barricades, especially in the downtown core, but we do manage that on other events as well, so it's not a huge deal. But the Pride Society would have to be responsible for every single one of those intersections. The other thing that they would have to be responsible for, and Flowy Days already gets permission from the mall to use that marshalling area. So even though our parade route starts as the marshalling area as being the mall, we don't have exclusive, right? So that would have to be obtained through the Pride Society to be able to gain the access to the mall parking lot in order to start the marshalling. And then they would be responsible for also pulling down and just pushing the barricades off to the side when the event had passed. And then our crew would pick up everything on Monday.
So how do we want to, approach this? Councilor Darwood?
Well, taking those considerations in mind, of course, those are all necessary things, and I'd like to approve this request for the parade route and the use of the park and the raising of the flag for the one day. I think with world political affairs, I said the other day, this is more important than ever. So I'll make this motion.
I'll second it.
Put friendly amendment to have it raised here for the month?
Yeah, isn't that already on another thing? But yeah,
Yeah.
absolutely, no problem.
Oh, we already do, sorry.
Mhm.
Any comments or questions?
I just wanted to reiterate what Janet said. I think at a time with everything that's going on, that we all need to show solidarity and that we do care. This is our way of doing it.
Any other comments, questions? All in favor? We have the draft minutes of the Bear Smart Committee meeting held March 11th for information. Bear Smart, council rep, make any comments?
Yeah, has anyone seen any of the videos on the?
Yeah.
That's for recreation? Are you learning a lot? Are you bear smart or bear foolish?
Sometimes foolish.
I'm foolish.
I share my.
I'm Raven foolish. I don't know if anyone else is having that problem. but-
Yeah.
yeah, if you don't tighten the lids on your garbage can,
Yeah.
It is Bear Smart Week this week, so yeah, good timing, and all the local restaurants have their little activity sheets and coloring for all the kids to learn as well, and yeah, I think it's going along really well. And Port Hardy Recreation, of course, did amazing with the videos and just getting the knowledge out there. Of course, we had some shining stars as well that helped out with the videos. But yeah, that's not the part. It's Bear Smart Week.
Thank you. All right, we have the draft minutes of the Policy and Governance Committee meeting held March 11th and a number of recommendations. So we recommend that the council approve policy CP 2.11 sale of district surplus property.
Make that motion.
Moved by Counselor Dugas, seconded by Counselor Robertson. All in favor? Okay. We have the recommendation that council approve policy 6.3 professional development review. Moved by Counselor Smith, seconded by Counselor Tidbury. All in favor? Carried. And we have the recommendation that council approve policy 6.15 preventing violence in the workplace. Moved by Counselor Textall, seconded by Counselor Tidbury. All in favor? And the last recommendation that council approve policy CP 6.10 municipal employees on private property. Moved by Counselor Tidbury, seconded by Counselor Textall. All in favor? Very clear. But just wanted to mention that all these policies are significantly out of date, now are in date, up to date. So thank you very much.
And that we do discuss them at a committee before.
And we do discuss them. We have bylaw number 1179-2025 master plan for 2025-2029 for adoption. Counselor Tidbury, seconded by Counselor Smith. Any comments? We had the financial plan presentation by our CAO, Norman Isaac, and it was a great financial presentation, so thank you.
Got a promotion over there.
Sorry.
Yeah, she does it all.
Sorry about that. Any comments?
Great job.
Thank you.
All in favor? Carried. No pending bylaws. Council reports. Councilor Tidbury, are we missing a pending bylaw?
I thought we,
Or did we take it off there?
And maybe it's missing, it's probably still pending, it's still.
Yeah, it's still pending, okay. Councilor Tidbury,
okay, we did some updates on, Philomene's meeting. Just getting, and everything needs to be going okay there. Everybody, all the committees, the different committees, coming together now and reporting their activities, and everything seems to be going good there. I was at 7 Mile and at the golf club there, and in behalf of the mayor on economical development, and that was a very good meeting. Dennis writes lots of notes, so I'll get him to highlight some of the things that is done there, but I thoroughly enjoyed it. Quite a number of people there. We had about 50 people there in that neighborhood.
Yeah.
So it was really good. Still would have liked to have seen the mic over there, but that's one of those things.
No
oh,
sound.
they
That's
got
the
him
inner
right
sound guy,
there.
eh?
They have it right there.
They don't use it.
They don't use it. It's a little disappointing that way because you know, some of the speakers are really, and that's one of the first things I do now when I go into a meeting. I look what they have there. Do they have a mic there? If they don't have a mic there, I sit up the very front
You can hear.
so I can hear it. I listened in on the regional district meeting. We had our MLA Anna here, and we had a committee of the whole meeting there, and we discussed what her role is and some of our thoughts for the North Island, and that was kind of interesting. she's in the opposition now. You get a different kind of approach to things. So, but she was very nice. I thought the discussion was really good. Attended seniors meeting, and we had a gentleman from Boyd's funeral home come up and explain what happens, you know, in that horrible moment when we're no longer here, and what they do. And I actually taped it, and if anybody wants copies of this, it's definitely an eye opener. It tells them everything you want to know, and they're very helpful. They're very helpful. They're trying to avoid, you know, that final day, and everything is crashing around you, and then trying to find out information that you don't have or have. But they do everything for you as far as the body is concerned. Oh, and today we had a coffee meeting with Nora Al Gold, and that was interesting. Give us updates, what's happening up at the top end of the island, and where they are in the process of development, and that was kind of interesting to have. And that's me.
Thank you. Counselor Smith.
Thank you, Mayor. Attended the March 12th, the Philomi Days meeting. Things are coming along nicely for that. It's nicely organized, which is good. March 13th had the Port Hardy Heritage meeting. They reported some issues, but that's all been solved now with payment wise, which is good, I think. And then just to encourage anyone, if you haven't been to the visitor center, to see what Robin has done and the difference that having our local artists, First Nations artists, would display their work, and some that are also for sale is astounding to me. Like when I used to work in the visitor center, I can't believe that wasn't there to begin with. Like that should be the first thing that people see when they come in our community. And she's done a really great job with that, and lots of fun stuff to buy. So yeah, should be good things to come. But yeah, that's it for now.
Counselor Texmo.
I also attended the Philomi Days meeting on the 12th, which is my first meeting I've been able to go to. And I was kind of pleasantly surprised how much was already on the go and how much had already been kind of taken care of. It was exciting to see a bunch of new faces too. I'm told that, you know, I'm one of them, but it's nice to be a part of it. And then seeing how much council representation on there too, which is great. And then, yeah, with their policy and governance on the 11th, I really wished I could have been here to meet Anna at Kindy, right? Anna Kindy.
Yeah.
But of course, working during the day doesn't make it very easy to make these kind of things and standing with North Island Copper and Gold. But that's the way it goes. Other than that, that's it for me.
Yeah, Counselor Jacobs.
Thank you, Mayor. Yeah, I got to attend a number of the meetings that it's already been mentioned, that John mentioned. Great meeting. I had an opportunity to meet also with our MLA Anna Kindy with regards to North Island Seniors Housing Project, and had a great meeting. She's very understanding. She's already given us a letter of support for the project, and she will try to work with us to get some meetings set up with some of the ministries to move that project forward. And I was surprised that John didn't mention that she actually, when she left here, she actually went up to the senior center.
Yes.
So talk about that a little bit, John.
Yeah, we showed her all around the senior center and how we'd like a new center, but you know, that's always there. But she was very impressed. She was really impressed with the numbers that we have here. When I mentioned that we have 330 members, that's quite impressive for a small community like ours. not everybody attends in one time, mind you, but.
They did.
And we'd have a real problem if they did, but, and she was really interested in, with the number of programs that we do have up there. Like we're running every day.
Is that it, Joe?
That's it for me.
Okay, thank you, sir. The sixth annual Mount Wellington Economic Development Forum, that John had already mentioned that we attended. It was great attendance and it was a lot of really good topics that were discussed. Island Health, Ian Wood was there and gave a presentation that talked about a number of different things that they're doing with the hospitals in Port McNeill, hospital in Port Hardy, talking about some of the things that they were obviously concerned about, or we were concerned about when it comes to communication. They want to do a better job on that and keep people more informed of what's happening in the area. So that was awesome. Also talked about housing and the issue with housing with regards to bringing staff from wherever to come and get jobs up here, and there's really not anything available. It's hard for them, put it this way.
Seaweed.
Yeah, and also the seaweed industry too, like you're talking about that seaweed, not the wild kelp harvesting, because we do that in this particular area already, but they're talking about seaweed farms, and they're looking at setting up relationships with indigenous nations in our particular region and trying to find sites that would be, obviously approved by them, and working together with them as a partner to do a pilot project to see what the economic viability would be in our particular area. I mean, it's there. I mean, the seaweed industry is growing. But I think where we are right now with the Mount Wellington Regional District is, we know we can grow seaweed. What do we do with it when we get it growing, and how is it gonna be processed, and where is it gonna be processed? There's a big cost with regards to transporting it because of the weight of it. It's very heavy because it comes out of the water and it's just like almost water. So to try to dewater it costs money. But there are opportunities, hopefully, and as we've already talked to the federal government with regard to the transitional planning, we talked about that and the possibilities of that coming in our area. If we had processing in this particular area, that would really help, because then it would bring it into a position where it could be transported easily and at less cost. And then to the markets that are looking for it.
They have processing, but it's for the wild stuff, so I'm not
Yeah.
sure if that's the same or not.
It's a little different.
Yeah,
Depending on what market you're gonna get in.
yeah, fair.
Because some of this, just from what I understand, talking to Mark Feeler, a lot of this stuff goes for fertilizer that's being developed here.
Yeah.
But if you're trying to get into the food market, well, that's totally different. So it all depends what market you're gonna try
Different
to get
regulations.
Food
Great.
inspector here,
Yeah,
And-
and that's what we pushed.
Yeah.
into. Yeah,
Which we,
many times.
lots,
Yeah,
lots,
for
with the federal government.
Yeah.
And those opportunities, yeah. And I thank Janet and the Rotary Club for the opportunity to come to their lunch and talk about our seniors housing project, and looking for their support. We already have a letter of support from them, so thank you very much for that. And we're gonna be reaching out, obviously, just not for letters of support, but by some financial support from businesses and community members in the North Island, because we have to build our equity too with regards to the project. We had that meeting with Norel Copper and Gold. I guess, is it Copper and Gold or just?
she was coughing.
It's
Yeah,
copper.
Copper and Gold. Yeah, and that was really interesting. I thought, unfortunately, I couldn't stay for the whole meeting, but I thought it was pretty cool. Like, I mean, what could be possibly happening? And yes, I have been down to the visitor center, and yeah, they've done a tremendous job in there. It looks awesome.
Yes.
And I would like to thank our staff, Heather, and that group for getting the new lights put in, or not lights, but get the lights replaced, because now you go in there and you can actually see something.
That'll add.
It looks great, because I think probably there was only out of the 16, there was only like 5 running the last time I was in there, but now they're all working, so yeah, it looks awesome. It changed the whole look when you walk in the front door, especially on a cloudy, rainy day. Anyways, thank you, Mayor. That's it for me.
Mr. Robertson.
Yeah, we were away, for a lot of the time, so I wasn't able to attend the economic forum, which I was actually hoping to, but nor was I able to, meet with the MLA, but, we did talk about, and Dennis and I will continue tomorrow, talking about the Vancouver Island North Training and Attraction Society potentially reconstituting himself in a different form, but we'll see where that goes. I was able to meet also with the Liberal candidate who came to meet with councillors who could make it, and that was very interesting. And I was here for the NORAL presentation from Sam Lee as well, and it was fascinating. I think it's fascinating. It's clearly they're keen on the project and selling the project, and it's the potential is quite significant in our region.
So don't,
Yeah, I attended the Filomi Days meeting and I was impressed. All of these tables were together and it was just jam packed. I don't know how many people were here. It was really full, and some old faces and some new faces, and that's a really good mix. The new chair, Susan Pike, she is organized and she's got like Google Drives for everybody to
How's
share
your
into, and
Susan
Peck.
Peck?
Peck.
no, Pike,
Pike.
not Peck.
Okay.
That's a
Different one,
person.
different.
You got it right.
Okay, Yeah.
Sorry.
Anyway. she's doing an amazing job, and she says, I think she's never done it before, or whatever. I'm like, well, you can't tell. She's doing a really good job, so, yeah, I think, good leadership there, and, Filomi is gonna be just as great or better than ever, so. And everything, like Councillor Texmo said, everything is really well underway already. Like, I think, like, all the musicians are booked or something, I'm like,
And
yeah, I don't know all the stuff, but
Yeah,
so much.
things done, yeah.
So, pretty cool. I attended the Chamber of Commerce luncheon. BHP presented. Heidi, who looks after the site here, the site's been closed since 1995. BHP, we all know, looks after it in perpetuity. There's no end game on that. So I have lots of respect to BHP for taking their responsibility seriously and looking after our environment out there. They're doing a great job. They're meeting all the targets. So it's all good. And I met with the Liberal candidate for the federal Liberal Party. Always like to hear what everybody has to say. And I don't agree with everything. But it's
Like
always
myself, who does agree with everything.
Put that on the wall.
No.
remember that when I want you to agree with me.
That's right.
Anyway, I don't know. I think it's good to hear what everyone has to say. I like to have an open mind when it comes to all these things. I did something else. What else did I do? Oh, we had went the meeting with Anna Kindy, of course, was Emily Anna Kindy was good, and lots of stuff there that we're going to follow up on.
Mhm.
And I look forward to getting her pushing on that. And yeah, she's the health critic too, in case
Yeah.
anyone doesn't know. So that's it for me.
Thank you. So, I'm go backwards. I have attended a number of Sonala Culturally Supportive Housing Board meetings and meetings with consultants in BC Housing. Attended the Mount Wellington Regional District meeting. The financial plan was approved. Happy to say Port Hardy's grant and aid request was approved totally, which I was really pleased about. And as well as Councillor Dorward said, meeting with all the candidates and getting knowing what everybody's positions are is so important, and whether you're a Liberal or NDP or Conservative or a Green Party member or voter, it's so important to vote, but also to hear what everybody else is talking about
Did
too.
you hear if they're having an all candidates meeting?
Not yet,
No.
but they're hoping to, but we haven't heard it.
They're having one in Alert Bay on the 17th, mid-April, so we can.
So hopefully there'll be one here. So thank you, Councillor Tidbury, for representing me at the Economic Development Forum. Thank you, Councillor Dugas,
Oh, I
for
remember.
representing me at
forgot.
the provincial under-18 girls hockey tournament. I unfortunately spent a number of days on my couch, whining and sniveling. Everybody that could hear me, no one was in the house because my husband disappeared all the time. But before that, I was at the LGLA forum in Richmond,
Mhm.
and a couple of things that really, it was probably one of the best training events I had gone to as an elected official. But I did want to give a big shout out to our staff, because I went to one thing about engaging with the province. And they listed strategies that work well. some of it we can't do because it's really hard to build a relationship with a minister that's in Victoria. It's too far to drive. Our finances aren't such that we're down there to run down and make an appointment. But what we do well and really well is when we go to our 15-minute speed dating, we're well prepared with solutions and answers. We're well prepared with how the issue connects with what we're doing as well as what the government is doing. We stay focused. When we go as a group, it's one speaker is the main speaker or one person is the main speaker. And we always ask when we can meet again by inviting them to come to our community. But as well, we have something to leave them with so they know what we're asking for. And that's why I really think we get such detailed letters when we come back from these meetings. It's because we go prepared. We might not always get the answer we want, but we go prepared.
The staff is amazing at all that.
Yeah,
Yeah.
so thank you very much. I just, when I went to that, I thought, okay, tick, 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 tick. Yes, we're doing that, and thank you. So really appreciate it. But as well, one of the things they did say is look at what their mandate letters are with the government office or the minister's mandate letter is, and make sure we connect it with the ask. And I just said, oh, yeah, I'm pretty sure we do, but I'm not positive. So that's something that we can look at. And then building trust around the table. And we all trust one another and we trust our staff, but making sure that we are honest and transparent and accountable. But as well, really stress that when we're looking at doing something in our community, it's not for tomorrow that we're looking at doing it. It's for 5 years, 10 years, 20 years, 25 years down the road. And we want to make the community as best we can. Anyways, I couldn't believe all the notes I took, which to me was unlike Councillor Dugas. I don't take quite as many notes as him, but I took a lot of notes each day after it. I spent time writing out my notes and things like that. So it was really, really good.
I always feel so bad sitting next to Dennis.
Me
That-
too.
He writes and he writes and he writes.
And he's a very kind person. He's always willing to share.
That's right.
I should do some more sharing. You guys would get very bored.
Anyway, so that, yeah, that was it. That's about it. So thank you. We have an in-camera meeting following the end of this meeting. Motion to adjourn. Councillor Dugas. Oh,
We got.
sorry.
Making a motion to close the meeting under section 92 of the community charter to go under section 91B.
Thank
And
you.
then we'll adjourn when we're done.
What she said.
Exactly what our CAO said. This is the first time, just so everybody knows, this is the first time we've done this. So really appreciate
Did you-
having a direction.
I'll second that.
But we,
Do they get to? answer?
Yeah, they-
Question
they-
before we-
yeah.
Question,
Yeah, we
please.
keep
yeah, well,
question period and then-
yeah,
Okay, good.
the questions.
I guess I'll address this to Councillor Lucas, who takes the notes onto the economic.